Angina is chest pain or discomfort caused by reduced blood flow to the heart muscle. It is not normally life-threatening, but it is a warning sign that you could be at risk of a heart attack. With treatment and healthy lifestyle choices, it is possible to control angina and reduce the risk of more serious problems. This slide demonstrates how heart disease forms within our arteries. This can form in patchy areas which can impede the blood flow through the artery. Angina is usually caused by a buildup of a fatty substance known as atheroma. This causes the coronary arteries supplying the heart muscle to become narrowed. Atherosclerosis can be made worse by the following: unhealthy diet, lack of exercise, smoking, increased age, family history of atherosclerosis or heart problems. This slide demonstrates where the symptoms of angina may be felt. Symptoms of angina could include chest pain, which may be tight, dull or heavy. The pain or discomfort may radiate to your arms, very often the left arm, jaw and teeth. Some people may also experience shoulder and back discomfort, as well as maybe shortness of breath. Some people may experience indigestion type symptoms. The symptoms are not the same for everyone. For some, the pain is severe, while others may only feel mild discomfort. Angina may be triggered by cold, windy weather, changes of temperature, physical exertion such as walking upstairs or inclines, emotional stress, heavy meals, and also making love. There are two types of angina you may be diagnosed with. Stable angina, this is the most common type of angina that people are diagnosed with. The symptoms come on typically with stress or exercise and improve with rest or GTN. Unstable angina, here the symptoms are more unpredictable and they may not have a trigger and can continue despite resting. If you see a GP after an attack of angina, they may ask you about the following: the signs and symptoms you've experienced. What were you doing at the time? For example, did the symptoms come on with exertion or at rest? You may be asked questions about your lifestyle, for example, smoking, diet, exercise and family history. If the GP suspects you have angina, you may be referred to the hospital for further tests. You may be referred to the Rapid Access Chest Pain Clinic, where you may be seen within 2 weeks of referral. Investigations will include a detailed history of your signs and symptoms. You may have an ECG performed. Your doctor may also request an exercise tolerance test. Depending on the results of the above, your doctor may request for you to have a cardiac catheter, also known as a coronary angiogram. Blood tests may also be performed to help with your diagnosis. Treatment: if you're experiencing symptoms of angina, stop what you are doing and rest. Take the GTN spray or tablet. Take another spray or tablet after 5 minutes if the first one didn't help. If after 2 sprays you are still experiencing angina type symptoms, you must call 999 for an ambulance. If you are diagnosed with angina, there are 3 different treatment options available for most people. These include medical management of your condition, which you will be prescribed appropriate anti-anginal medication. Coronary angioplasty may be offered to some patients. This is known as percutaneous coronary intervention. This treatment widens the narrowing within the coronary artery. Coronary artery bypass surgery may be offered to some patients. This is where a vein or artery is taken from your leg, arms or chest to bypass the blockages within your coronary artery. The number of grafts you may need will depend on how many of your arteries are narrowed.